Thank you, Mr. Chairman. Just a few months ago, the Democratic governor of New Mexico, Michelle Lujan Grisham, issued a, quote, public health emergency order to suspend the right to bear arms in Albuquerque and surrounding Bernalillo County. I think I pronounced that correctly. She was warned repeatedly by officials in her state that such a suspension violated the Constitution. A group of our colleagues here, including Senators Tillis, Graham, Kennedy, Blackburn, and Cotton, and I wrote to the Department of Justice to intervene and protect the constitutional rights of New Mexicans to carry a firearm outside of their home. Our request was consistent with the Second Amendment and the court's jurisprudence, and I expect that the court of last resort will find the same. But unfortunately, that doesn't mark the end of the road for this latest attack on what is a constitutional right. That's something some of our colleagues consistently overlook. And the fact is that a firearm in the hands of a law-abiding citizen is not a threat to public safety. Indeed, there's a story, I think it's in the Washington Post today, by Philip Bump, who points out that 52% of American households have a firearm in that household, 52%. Washington Democrats have unfortunately chosen to follow Governor Grisham's lead and are now using public health as a guise to address their concerns. I wish they had the same concerns about the number one cause of death for Americans between the age of 18 and 45, which is fentanyl poisoning. Fentanyl made from chemical precursors from China going to Mexico, made to look like relatively innocuous pharmaceuticals, which are then smuggled into the United States. And unfortunately, many young people end up consuming what they think is a relatively innocuous drug and die as a result of fentanyl poisoning. Well, we don't have to look far to see that examples of executive overreach that have relied on so-called public health emergencies. During the COVID-19 pandemic, too many politicians were quick to shut down houses of worship and church services while allowing other businesses and other organizations to operate. Here in Washington, D.C., for example, Mayor Muriel Bowser refused to allow the Capitol Hill Baptist Church to hold outdoor church services because of a public health emergency. The judge in that case found that the mayor had exceeded her authority and had substantially burdened the free exercise of religion. It's important to note that the application of these so-called public health precautions was not even-handed. While many politicians deemed it unsafe for businesses to operate or churchgoers to attend worship services, they seemed to have no problem with packed BLM riots, as in Black Lives Matter riots in the summer of 2020 that caused millions of dollars worth of damages. So we have a trust issue and a constitutional issue when we use the public health approach to attempt to strip away core constitutional rights. The other problem with the public health approach is that the most effective solution to firearm-related homicides and assault is effective criminal law enforcement. That means effective police, prosecutors, courts, and prisons. We know that these tools actually work. We know they work because we have historical data in order to prove it. As law enforcement efforts were stepped up in the early and mid-1990s, we saw dramatic declines in criminal violence of all kinds. One of the reasons for this is that the concentration of gun violence is among small numbers of the population. It's not the general population, it's a small percentage of the population where this phenomenon exists. In Washington, D.C., for example, in 2021, a study found that only 500 people were responsible for up to 70% of the gun violence in the district. In Boston, a 28-year-old study found that half of the city's homicides were committed by 1% of the population. involved with gangs primarily. A 2014 study showed a similar situation in Chicago. What all of this means, I believe, is that if you empower law enforcement to selectively investigate and prosecute repeat offenders, you can dramatically reduce the gun violence in a community where it's a problem. By removing the worst criminal elements from the community, everyone is safer. That's the original purpose of the Project Safe Neighborhoods program, which passed out of the Senate this year. That program focuses on investigating and prosecuting the most dangerous and violent criminals in our communities to ensure they do not continue to harm other people. And we've seen over the last 2+ decades, it's had an overwhelming success rate at reducing violent crime. Successful programs like Project Safe Neighborhoods require both resources and political will. You can't simply achieve safer communities by defunding the police or letting violent offenders out on bail like, unfortunately, too many prosecutors have been willing to do in communities across our country. Today, violent crime is ravaging many of our communities, and the public is, of course, taking notice, as they must. Here in the District of Columbia, carjackings are up dramatically. And I have to believe that a lot of this has to do with the perception that there will not be consequences associated with committing such crimes against innocent citizens, including members of the United States Congress. A recent Gallup poll showed that 63% of Americans describe the crime problem in the U.S. as either extremely serious or very serious. That's the highest level since this particular poll began in 2000. And 77% of Americans believe there is more crime today in the United States than there was just a year ago. Again, when we talk about the gun violence epidemic, it seems as though a substantial part of that debate is our current crime problem, which has spiked due to the left's soft-on-crime policies and the defund the police movement. Of course, we know the other side of the gun violence issue is mental health. This is especially important when we include firearm-related suicides, as the chairman said. About 60% of the gun deaths in America are the result of a suicide, someone taking their own life. And of course, we know that the Bipartisan Safer Communities Act, which we did pass, made the single largest investment in community-based mental health care in American history. A good start. In 2023, a survey from Mental Health America found that 21% of American adults have claimed symptoms of a mental illness. That's 50 million Americans. A 2015 study published by the Annals of Epidemiology found mental illness is strongly associated with increased risk of suicide, which accounts, as I said, for more than half of the gun-related deaths in this country. Suicide is a mental health problem, and we're not going to fix the issue by denying people their constitutional right to keep and bear arms, at least among the general population. Countries like Belgium, Japan, South Korea all have higher suicide rates than the United States, but don't have a Second Amendment. Mental health problems are also often involved in mass shootings, as we know. In the wake of the Buffalo and Uvalde shootings, we looked at the profile of these mass shooters and found that many of them had serious underlying mental health problems, mental health issues that were unaddressed and untreated. Many of our colleagues, including Senator Tillis, Graham, Durbin, and Coons, and many others worked together, as you've heard, to pass the Bipartisan Safer Communities Act. I think that bill has already saved lives. I get regular updates of the success of that law as it deals with mental health and violence in our communities. But there are other parts of the bill that are working as well. Since the law was enacted in June of 2022, the Bipartisan Safer Communities Act, new criminal penalties and firearm trafficking had led to more than 100 new charges against dangerous cartel members and firearms traffickers. The enhanced juvenile records check alone has stopped 400 transactions of people who would ordinarily flunk a background check were they an adult and you only check their adult mental health and criminal history. But now, because we have an enhanced check that include juvenile records, 400 transactions have been stopped, while 98.5% of the background check system is unaffected. This, of course, builds on the positive changes that came from a bill we called Fix NICS, the National Instant Criminal Background Check Act, which was signed into law by President Trump in 2018. That law has led to the uploading of millions of new records into the FBI's National Instant Criminal Background Check database to prevent those who are already legally prohibited from possessing a firearm under existing law from obtaining one. All this was done, both Fix NICS and the Bipartisan Safer Communities Act, in a bipartisan way without infringing the rights of law-abiding citizens. The point is we can find ways to come together to get things done, but using public health authorities as a blanket excuse to strip away constitutional rights or framing gun violence as an epidemic divides us more than it unites us, and it really kind of misses the point. These are not autonomously fired weapons. They involve human agency. And as we've seen, when we focus on the humans, we can have a very positive impact. So I hope we look at the entire picture of gun violence, which includes focusing on repetitive acts of violence by a small percentage of our communities, focusing on mental health diagnosis and treatment, and finding ways that we can address gun violence like we did in the Bipartisan Safer Communities Act. Again, all without infringing on the rights of law-abiding citizens. Thank you, Mr. Chairman.
Thank you, Senator Cornyn. And you've raised some very important issues like